Great. Okay, we are on again. So thank you everyone for joining. Got quite a few people on the call today, and we'll probably hear a few more people joining as we start here. So we are here for the Policy and Advocacy Update webinar. We have an hour-and-a-half planned for this, but it may take less time, in which we will actually go ahead and take less time if that's the case. We want to make sure we have time for questions and all those different pieces. And I'm great. Okay, wonderful. So we are, before we start, actually, Rivka, would you want to run through a little bit of the information about before we start?
Sure. Just to let everybody know, we're going to be muting all participants who have either joined by phone or computer, and we'll do Q&A at the end, but feel free to message us through the chat. We'll have a few different sections we'll run through, and a time at the end of those sections for writing in your questions, and we'll address some of those as we can, but at the end of the webinar is where most of the Q&A will happen. If you're having any issues, also feel free to message us in the chat box. If you're not connecting or can't hear, there's also a link here that you can access Citrix and look at the user guide if you're having some issues and where our solutions aren't helping you. Also, just to let you know, we're recording this webinar, and we should have it available after.
Great. Great, so let's get started. Oh, the other thing I'll mention is after, so we'll have the webinar, we'll also just have the slides independently available as well, and then also we'll have a set of resources and tools and links to those coming out as well afterward. Great. So before we start, I just thought we'd ground in what we do here with Policy. As a network, we engage in policy and advocacy to improve the lives of vulnerable Oregonians and the ability of community health centers to serve them. At today's update, we'll go through the federal and state policy landscape, including the latest news on healthcare policy at the federal and the state levels. We'll highlight the OPCA policy priorities. We'll talk quite a bit about the advocacy strategy, how we'll actually achieve those policy priorities, and then spend time on a set of 5 immediate advocacy steps that your health center can take to engage and help to make that policy and advocacy strategy be successful. Oops, there we go. Great. So let's start with a federal level policy update. And then we'll do federal level policy update, and then we'll move into a state level policy update, and then we'll focus on advocacy last. So it's sort of 3 big chunks. Great. So for anyone who was on the NAC webinar on policy and advocacy yesterday, this might be a little bit of a reminder for folks who've been following those. So I'll go through it pretty quickly, and I think most people are pretty up to date, but I'll just highlight the really important pieces post-landscape and then get into the key updates right now and some of the pieces that we've been doing already. So first, clearly some surprising presidential election results, and which create a whole different dynamic. The nominees for HHS coming out of the Trump administration are Tom Price, who gave some of his first remarks yesterday, and Seema Verma is nominated to head up CMS. Seema worked with Vice President Pence in Indiana, working on their unique approach to Medicaid expansion in that state, and so that's a very interesting piece there. I mentioned on the slide you can see the breakdown of the federal House and Senate, the 52 Republicans and 48 Democrats in the Senate, 239 Republicans and 194 Democrats in the House. really it's the Senate ones that are really key. There are a very few number of things that can happen through the Senate with only a majority through a procedure called budget reconciliation. So the fact that that 52 Republicans in the Senate, very few things only take 51 votes in the Senate, and most major policy pieces would be subject to the filibuster, so they take 60 votes. And so that's a really key piece there, and that will come into the sort of the in-the-building strategy and the procedural piece quite a lot. Looking at Oregon, how Oregon relates to the federal scene, there's a number of really key players, and two of the most important committees are the Energy and Commerce Committee and the Senate Finance Committee. And two of Oregon's members in the delegation are key players there. Representative Greg Walden from District 2 is chair of the House Energy and Commerce Committee. He was newly appointed. He's been on that committee for a long time, chairing a subcommittee, but now he's in the role of heading up that committee. And his district, of course, is sort of the Cascades and eastward and southern Oregon. So really important part of the state, and he's a key person in that role. That's the committee that will be heading up the work around what to replace the ACA with, and actually developing that replace plan. And so that's a really key piece. That committee also has jurisdiction over Medicaid broadly, the Community Health Center Program, HRSA, BIPIC, the National Health Service Corps, you name it. If we care about it, it's in that committee. Senator Ron Wyden is a Democrat and is the ranking member from the Democratic side on the Senate Finance Committee. He has been on that committee for a long time and plays a really important role. On the Senate side, this committee is really critical, of course, to the budget and the finance. So fixing the funding cliff and Medicaid spending is also a key piece there. So those are two of our really key folks. What's at stake in the Affordable Care Act? So we've got a number of things that are at stake right now that I think wouldn't be it's come as a surprise to most people. The first two, the Affordable Care Act and the Medicaid program generally, of course, is a key piece. Also the Section 330 Health Center grant funds, or the funding cliff, is another key piece. The next two are slightly, well, they're slightly less, slightly less of a high priority, mainly because there are not current significant threats in those areas. We actually think those are in pretty good place, but we want to be really conscious of that. So I think talking a little bit more about the Affordable Care Act, the repeal and replace, the main frame for this, the Affordable Care Act and repeal and replace will really be the main frame for all healthcare debates in Congress in 2017. It's going to be, it's the overarching thing that sort of everyone's talking about. And that's important to know just within that larger context. The other piece that's really important here is that while Congress has taken steps now last week in both the House and the Senate to put in place a blueprint for how they would do the repeal with just 51 votes using budget reconciliation, they the plan to replace it and actually create new legislation would take more than 51 votes. So that is a more substantial piece, and because of that, we believe it will take longer for this process to happen. That's important because while talk at the earlier was they're going to repeal the Affordable Care Act and then have an effective date of a couple years later, our message and the message of many has been don't repeal unless you have a replacement plan in place. That message has been very successful, and even President-elect Trump said, no, we need to replace it. We need to have a replacement that same day, even within the same hour. So we cannot have uncertainty there. that's pretty big, because as soon as you actually have to have a replacement plan, it means you're going to have, most likely, unless someone might figure something out, but most likely you're going to actually need to have some Democratic votes to make that happen, and that will take a larger debate. So that's a really interesting development in the last week. Is really our thinking that this is, instead of being something that's happening in the first month, we're really looking ahead into more of, things are happening constantly and it changes every moment, but looking at late February, early March to be really key times when action will happen. The other piece to note here is Medicaid program. So there's been a lot of conversations around changing Medicaid, and some of this comes from bills that Tom Price has been part of around how to change the Medicaid program into block grants or per capita allotments, and to allow even more flexibility at the state level. Of course, there's already quite a bit of flexibility, as we know, with the waiver. So I think the thing to know about with this is just that we would be very concerned about changes to the Medicaid program. We can't really have an opinion without knowing the details, but certainly the potential for cuts to the amount of money that states have, to changes in how payment works, and security for patients to know what kind of care they would be able to get, all would be in peril, so that we would be paying a lot of attention to that. So moving forward, looking at those different challenges, and actually I want to just go back to the slide a little bit to just touch on the Section 330 health center grant fund. So we face another funding cliff this year, and the important thing to know about the difference, I think, between procedure-wise between the Affordable Care Act repeal, changes to Medicaid, those Congress would actually have to do something to make those happen. The funding cliff is something that will already happen on September 30th of this year if Congress doesn't take action to fix the funding cliff. So that's an essential difference in that piece, and so that dynamic means that we'll be trying to get that funding cliff fixed on pretty much every piece of legislation that goes through Congress. And every piece of legislation that goes through Congress this year will be very contentious. So this is going to be a really tricky process, but we have hope in a couple of areas. And then another important piece to know is the funding for the National Health Service Corps, teaching health centers, and CHIP are also up with that same deadline. So coordinating between all of those will be really key to get that fixed. And again, there is not a bill or any specific threat that any legislative piece that we know of on 340B, but there has been a lot of scrutiny on the program, mainly having to do not with the health center piece of it, but more a big fight between the drug companies and the hospitals, but there could be unintended consequences for changes, so it's just being monitored closely by our friends over at NAC. Continuing forward, so a couple things that put us in a pretty good space. A couple strengths. Health centers are in every state and nearly every congressional district. We have bipartisan support for health centers, and health centers can tell the story of the impact that repeal and other changes would have on patients and community health centers. So health centers are one of the few things in healthcare and in Congress that Democrats and Republicans agree on, and we have evidence of that, seeing those funding cliffs get fixed last time and through just long-time support. So that's been a really key. And then the ability to turn out and tell that healthcare story across every congressional district is really key. So an example of that is just recently, last week, we participated in a larger fly-in effort. Isn't it wonderful? So we had a fly-in, Brenda Johnson from La Clinica and Vanetta Abdulatif from Multnomah County, flew to DC in the ice storm, the heroes that they are, and met with Congressman Walden and Senator Wyden we have a picture here of Brenda kicking Congressman Walden out of his seat and sitting there in front of him. And I just pulled a picture of Vanetta off the web without her permission, so hopefully she'll forgive me for that. We actually have Vanetta here today to share a little bit about coming from that that fly-in, and to share a little bit about what was helpful about that and some of the pieces coming out of it that are a good lesson.
Hi, folks. Brenda and I got to deal with the cold in D.C. and the cold here, but it was good. I think that what was interesting is that part of the fly-in, I think that we had a chance to connect with other leaders nationally, and so NAC has done a lot to help with preparation around the talking points. And so Brenda met with me with Wyden. I didn't meet with her with Congressman Walden, but I think that all of our legislative representatives, it seems to me like they're trying to get, oh, Rachel lost sound. It seems like they're trying to figure out how to get their own sea legs. So that made it, for me, felt like we're all kind of in this together, figuring out which way we want to move forward. Even Congressman Walden with some of the things that Brenda shared. So a couple of things that they talked about is from Wyden's office, they said that it would be really helpful if we as health centers continue to talk about us having flexibility today, that Oregon's going to be really positioned very well because of the innovations that we've made, because of the savings that we've been able to put in place with CCOs and health transformation, and that we really need to talk about we don't necessarily need additional flexibility because the current waiver process has created so much flexibility and innovation today, as evidenced by here's our savings, here's how many people we've been able to see, here's how the folks have expanded. So that was one of the things that they've talked about. Senator Wyden also said that his group is not calling it repeal and replace. They want to call it repeal and run. I think it's a little too political for us, but I thought I got a chuckle out of that. The other thing that they really need a lot of are patient stories. Those patients who now have coverage who didn't have coverage before. What was their life before they had Medicaid? What's their life like now? Have they been stabilized or costs going down because of it? And they want stories from patients that are credible stories. So if we're putting together stories, Central City Concern had some really great ones that I think Laura shared and Brenda had some. I was able to pull together one, but people that you know are actually patients who actually, they're stories that you have enough confidence that they're credible stories are what's going to be helpful to them. Senator Wyden's office was also interested in addictions and narcotic people who are overcoming addictions, and wanted to have stories around that. So that some of us who have the MAT grants from HRSA, the substance abuse grants, how has that been helpful and successful? I shared a story with Senator Wyden's office. Our dental providers are no longer prescribing narcotics for the most part, and they've really gone down and using Schedule II drugs. And so we shared some of those numbers with them as well, because they're worried about people getting addicted and staying addicted. And then just generally the things that we do well, how are we the fabric of our community? Do we really get, do we know our local legislators? Do they understand the economic engine that FQHCs are? Yes. Is Brenda on the, was Brenda able to?
That's great. Thank you so much, Vanetta, for sharing that. I think that that's concerning from lawmakers around impact be, and what would the impacts be on health centers, what would the impact be for patient communities, for families, and so we really have the opportunity to share that now. I'll go into a little bit more of this piece. So on federal priorities, these are the pieces that NAC is focusing on. These mirror quite, as you can tell, the the things that are at stake. So the goals are protecting Medicaid. On average, Oregon Health Centers have 59% of patients have Medicaid coverage. That's higher than the national average because, of course, Oregon expanded Medicaid, but it's over half everywhere across the country on average per state. So it's a huge piece. Other key pieces are just Oregon CHCs serve 1 in 4 patients on the Oregon Health Plan. We're probably the single largest primary care network in the Oregon Health Plan, so we have a really big role to play. And of course, the unique FQHC payment is also something we're watching really closely, both in the ACA piece and also larger changes to Medicaid. The second is fixing the health center funding cliff. Important piece there is Oregon CHCs leveraged nearly $80 million in federal grants. That's money that's coming to Oregon that wouldn't otherwise come with community health centers. And then, of course, advocating for funding for health workforce programs and protecting 340B. In terms of the top messages right now, there's really 3 main pieces that we're focused on at the federal level. So one is that just the fact that we're have broad support from both parties, bipartisan support, and as Congress debates the future of healthcare, we want to be part of the solution. The second message is around the funding cliff and Medicaid, and really making the point that those are the 2 pillars. So the Section 330 grants, the base grants, and strong Medicaid are the pillars of health center success. It's surprising, but I feel like we've run into this both at the state level and the federal level, where a policymaker may think they understand health centers, but they kind of put health centers and Medicaid in 2 different buckets. Like they want to save health centers but destroy Medicaid. And those are the same thing. So if you've got more than half of your patients on Medicaid and are absolutely, those are, health centers stand on those too. And if either one falls, patients will suffer. And so making that tie, and this is an interesting piece, not only that that's an important piece for them to understand, but health centers have a unique role to play in reaching out to Republicans to make this point that Medicaid is actually a critical part of making health centers successful.
Can I add something here that that was kind of important that they talked about verbally but not in the materials? One of the things that they talked about is that they wanted us to be prepared for the question, well, if we take Medicaid from Planned Parenthood, that can help fund your services. How do you feel about that? So that was one of the things that they wanted us to be prepared for. I did not receive that question, and Brenda did not receive that question, but there were a lot of people there that did. And what they told us to say around that piece is, we're really here to talk about our own work. We don't know enough about how they're structured. We don't know anything about their business, but this is our business piece. But that kind of pitting one vulnerable organization and community against another is the environment that they want us to be prepared for and not get caught off guard.
Right, that's a key piece and I think actually sticking to these top messages is a helpful way to say, before we start thinking about how we could take over some huge thing, wait a minute, we have to keep ourselves whole at all. That's a totally different conversation. So helping them to understand that that's the position we're in can also help to make that question go away.
Take focus.
And then finally, the main message here is really, we're concerned about repealing the ACA without a clear plan to replace it that ensures continuity of care. One of the big developments of the last week has been that the Congressional Budget Office came out with an assessment looking at the repeal plan and previous repeal plans, the repeal without a replace. They said if Congress repealed the ACA without replacing it with something, you could expect 18 million people to lose their coverage just in the first year. So it puts the replacement plan at kind of a high bar. It says, is that replacement plan going to cover at least 18 million people with continuity of care, with good coverage and good access to care? So that's a really critical piece. That's a message that is being shared by a lot of different organizations, and I think that's a really critical one. So that is, maybe I'll go back to it. So that's the federal update for those pieces. We'll get into sort of the what next, or how to address it in the advocacy section. And in the next section, we'll talk about the state level dynamic, because of course at the same time that we are working to do everything we can, given our two very important members of Congress, to affect that piece. We want to be making sure that we're moving forward in Oregon, both within that debate and potentially outside of it, to protect health centers and the patients we serve. And so just if there are any key questions that anyone has coming up around the content of this, that would be great. And it sounds like we're having some technical difficulties where people have lost sound, in which case you can't hear me. So if you've lost sound, please get off the webinar and try rejoining, and that's in the chat as well. So one key question here that that Rachel's asking is, was Walden supportive of continuing Medicaid expansion? And the answer on that is, unfortunately, he's open to hearing all of the arguments. What would the impacts be? You know, it depends on what we could replace it with. What would that look like? And so I think he's not committing to anything. Certainly, I think one thing that's important to note is that the messaging coming out of his office and from his committee and from many working on the repeal effort has not been about Medicaid. It's been all about the exchanges and how extensive the private coverage is and how high the deductibles are. It hasn't been about Medicaid. And I think that's very telling. There's not a good case to be made for why to repeal Medicaid, the expansion. It just isn't there. They're not focusing on it. It doesn't work. So I think that is exactly the piece we'll go forward. And the other thing I'll note is there was a good interview with Congressman Walden soon after he was appointed, in which he mentioned that he's proud of what Oregon's done in terms of the waiver, in terms of CCOs, and being innovative and really reining in costs and improving health in that manner, and that he wants to make sure that his other members of Congress understand that as well. So he is in a really important position, but he's also part of a very large thing that he is not the sole person driving, and so the more cover that I think we can give him, the better to make that case. Great. I don't think we have other questions at this point, so let's move now to the state piece. And, oh great. Let's see, so state level policy update. John Eames, are you on the, if you're on the phone, we can unmute you. And I think John is going to carry us through here a little bit if we didn't lose him in our world of the webinar.
Right, can you hear me now?
Yes, we can.
All right, fantastic, I'm on. So do you want me to start, Laura?
Yep, go for it.
All right, guys. So the post-election landscape, so most of you know a lot of this information, but there's actually something that just came out just moments ago that I can brief you on, which is the co-chair's budget, and we'll get to that in a second.
Hi, John, can you just speak up a little bit?
Oh,
you mind?
I'm sorry. You bet. Is this better?
Yes.
Okay, great. Okay, so post-election landscape, pretty simple. Governor Brown was reelected. The House, actually there's a little bit of a mistake here. There's only 35 Democrats and 25 Republicans. And then on the Senate, there's 17 Democrats and 13 Republicans. So the House basically maintained their same level that they had. The Senate did lose one seat, and that was the Senator Alan Bates seat, which is pretty key in the healthcare world. He passed away suddenly last year, and the Republicans did pick up that seat. So what's important about these numbers, and I think in the context of this legislative session in particular, is that due to these numbers, 65 and 17 as far as the Democrats, the ability for them to pass additional revenue, they need 36 votes in the House and 18 votes in the Senate, and the governor agreeing to it as well. So they're one vote favor, and if the Republican caucus is able to hold their entire caucus on revenue-raising votes, then the Democrats will have a difficult time trying to raise additional revenue for the budget. So in addition, as you can see, Lynn Saxon continues to be the director of the Oregon Health Authority, which is, of course, very important to us. Because everybody is unmuted, if you could mute your phones, that would be wonderful.
You move to the next slide.
All right, next slide. All right, so yes, we have a very significant budget shortfall. The first bullet point there, human services budget at risk, is actually quite appropriate for the time. We just were given the co-chairs budget, and this just came out literally minutes ago. And the co-chairs, it sounds like someone needs to be muting their phone. Sorry about that. The co-chairs budget is pretty dire, and it's pretty disproportionate as far as the impact on human services and healthcare in general. Unfortunately, the co-chairs have taken the biggest chunk, 27.5% cut out of the Oregon Health Authority. Now, there is some justification for that because a lot of the increased costs are related to, or I should say the drop in revenue is related to healthcare, but that's a really big swipe, which is, that's going to impact significantly the funding for the Oregon Health Plan. They also said that in their document that they're going to be cutting, I believe it's 300,000 people, 335,000 people off of insurance coverage that were recently added to the Oregon Health Plan under the Affordable Care Act. They would close wards at the junctions of Junction City and Salem, reduce inflationary increases to community mental health and addiction, and then also reduce other dental and addiction services. So for all intents and purposes, it's a really bad situation. Now, the co-chair's budget is meant to set the stage as far as the discussion for the legislative session. It assumes no additional revenue. The governor's budget that came out assumed a lot of revenue that came in through a variety of taxes. There was just a question that came in, did I say cutting 300,000 people off OHP? Actually, I said cutting 335,000 people off of OHP. So it's a terrible budget, but I want people, yes, it's really bad and dire with existing revenues to see these drastic cuts. I don't think that they have the votes. In fact, Peter Courtney, the Senate president, has said he doesn't have the votes to pass an all-cuts budget, and he doesn't have the votes right now to pass any additional revenue. So they're kind of stuck. But the co-chair's budget, it is important because that's what happens or what they would be considering if we don't have additional revenue, but it's not probably what's going to end up. That's probably not where we're going to end up, and with any hope and with any luck and with a lot of work and effort, we won't end up there. So just to go on, to keep going on, we need about $1 billion more to meet current service level, and again, the governor's budget, which had $1 billion in additional revenue, did keep existing numbers as far as eligibility, and it kept at current service level the benefits that are provided to the folks in the Oregon Health Plan. So there's also federal uncertainty. While we did receive our waiver renewal last Thursday, which is great news, who knows what the impact of a possible repeal and replace, or repeal and run, as Representative Walden likes to call it. And we also had a drop. There's a drop in the federal match rate for the ACA population, which is one of the reasons why we're in a significant budget deficit. And our actual overall FMAP matching rate declined as well. So that cost us dollars to our budget as well. So let's move to the next slide.
John,
So
there
bright
was a
spot.
question. I don't know. What does Walden call it?
No, that was
this is what someone just, I can't remember who called it that, who just mentioned that earlier on the call, but repeal and run is what they.
Yeah, it wasn't Wyden. This is Vanetta. It was Senator Wyden wanted to call it repeal and run.
Okay.
Yeah.
Oh, thank you for the correction. I appreciate that. I see what he's doing.
Got it.
Okay. So some of the bright spots in the Oregon landscape, the governor's budget, again, did not cut OHP, kept current service level, did not cut benefits. It did do a couple things. I'll talk about that in a little bit, but it also included funding for couple hour kids, which was about $55 million. We did a round, OPCA did a round of visits with legislators, actually trying to have legislators sign on in support or onto the bill for Cover All Kids. And we actually had some great success. And there's bipartisan support at the top of the bill, which means the chief bill sponsors. There's both Republicans and Democrats. So that's a really good sign in that the Republicans are not just saying we're not going to support anything that needs additional revenue, but they're really looking at this from a policy perspective in that this is the right thing to do. So that is heartening, and hopefully that lends itself to a better discussion through the legislature as far as what resources are going to be necessary to support the policies that we're all supportive of. So on the governor's budget side, Cover All Kids is funded, and then again, like we mentioned, a lot of legislators are really taking a hard look at what is working in the system. I think they recognize that the CCOs have saved money for the state over the course of time, and they are supportive of that model. So as we serve 25% of the population in the Oregon Health Plan, or 1 in 4 have come into a F2HC, then we are really the backbone of the system, and that means that they are supporting what we're doing. So that's good news. Next slide. So
great.
Do you want to do this, Laura?
Sure. I'll give your throat a break. Sure. I think so. OPCA state policy priorities. Our top priority is protecting Oregon Health Plan patients. The governor's budget and the co-chair's budget really serve as two extremes. Although if we could just get the governor's budget, that'd be great. But those are really they are two different stories. One is without any new revenue, and one is with new revenue. So our top priority is protecting Oregon Health Plan patients. Make sure that the legislature is exploring revenue options to prevent cuts to coverage, to prevent cuts to eligibility, to keep people covered, and preserve health centers' ability to serve vulnerable populations. Second priority, or really, together with that first one, is actually covering all kids, wanting to make sure all kids living in Oregon have coverage. And it was really heartening to see both Representative Andy Olson from the Albany area and Representative Huffman from the Hood River, the Dalles area, two Republicans sign on, not just as co-sponsors, but as chief co-sponsors, and we were in the room for the meetings that led up to that and the meetings where they said yes. So that was really a great moment and sort of a counter story to a lot of things going on in the country. And And then finally, supporting policies and funding that go upstream for health. So in contrast to cutting and hurting people, and also just really kicking the can down the road, and that if we don't cover people, we'll be ending up paying more later. Instead, we should be going upstream, doing more primary care and prevention, and going upstream to the social determinants of health to go even further with the model that we have. And then key messages as we go into this session, and these will, this is sort of our best thinking right now. This will adjust and change as we deal with the session and as things change, but this is sort of our best thinking right now. So, nearly 60% of community health center patients are on the Oregon Health Plan. We know firsthand that cutting OHP would hurt our patients. Please pursue revenue options and prevent any cuts to the Oregon Health Plan. Oregon's community health centers work together with Oregon Health Plan to get results for patients and taxpayers. So asserting that we serve 1 in 4 OHP members, and we amplify state investment in primary care because we're community health centers and draw down federal grants and health workforce dollars to Oregon. Similarly, investing in prevention and primary care works. We've seen savings in the CCO model and also in the patient-centered primary care home program. All community health centers are PCH certified, and the recent study showed that even new patient-centered primary care homes saved total healthcare costs $13 for every $1 of investment. A pretty incredible result. And that study also found that after health centers, I think PCHs had been certified for, I think, 3 years, that savings doubled. So you get a lot deeper the more you go. And then finally, Oregon should build on the success of transformation by covering all kids and continuing to go upstream to lower costs and improve health. So those are the main pieces on the state piece. I think we have one question in the post. Just, John, if you can clarify the number in the co-chair's budget of number of people who would be kicked off the Oregon Health Plan?
Right. So what I was referring to is in the co-chair's document, which we can send out. It's a very high-level look. But these are in addition to a variety of other cuts, they did say that they would consider cutting health insurance coverage to 335,000 adults recently added to the Oregon Health Plan under the Federal Affordable Care Act.
Right. That is just devastating. And probably 1/3 of those are our patients. So that is, yes, indeed. Oh, we'll just add that in the box. So moving forward, so really talking about the advocacy strategy, moving now to do this piece. So what are we going to do? We've talked about the threats. We've talked about what we have going for us and our key priorities. Now this section is really about how are we going to make that happen? What are we going to win? How are we going to win? And in this section, I wanted to talk a little bit about sort of share our best thinking at this point, and know that we will be working with all health centers to refine and improve this strategy as we go forward, and to fill in the tactics and those key pieces. But this is sort of our best thinking right now on how we win. And the strategy is really to tell the story at all different levels, to mobilize as a network, to tell the story of the value that Medicaid and community health centers bring to Oregon patients and communities. So we're painting a picture, an accurate and clear picture of what's at stake. It's not necessarily a doom and gloom picture, but it can be, but it's really a picture of what we're doing and what could be lost. This is largely the same story of value and telling our value and demonstrating the value that health centers in Oregon have been having for several years now. This is really just puts a fine point and extra importance in this area. So I think, there we go. Okay, so immediate actions. steps. So sort of those are our big pieces, and there's a lot more detail coming around the different components. But these are the top things we think are key to start working on now as we move ahead. So number one is to sign up as an advocate with NAC and OPCA. So you can get those urgent emails that we are only sending when they really, really matter to districts that really, really matter right then. So they're done with judgment. So at NAC, and we'll send out the link to this, but this is on their Save Our CHC's main page. You can just hit join and you can sign right up. It's really easy. And then we also have a link to our piece where we will be doing pieces on the state level components. The second piece is to tell your health center's story, backed by data and by those individual stories that really put a face to the numbers. The third one is to build capacity for advocacy at your health center and building that culture of advocacy. NAC has a really impressive new program called ACE, the Advocacy Center of Excellence. I'm sure most of you have seen information about it. There's good resources, a great checklist. I'll go through a little bit about what are some of those main things in a little bit. But this would be a really great way to basically make sure that you've got that capacity to be able to jump into advocacy when you need to and have that culture there. It's the ability to get lots of storytellers and to engage lots of people in the work and folks in the community as well. And then three upcoming events that I think will be really great. So participating in person in March, we've got two big pieces coming up that would be great to get folks. We've got a lot of people registered already, and Health Center Day at the Oregon Capitol is on March 21st. It's going to be a great day with lots of meetings with lawmakers, and then just the next week is the NAC Policy and Issues Forum in D.C. And both of those offer an opportunity to tell that health center story, to share that key data around the value and the impact, and to share those stories, and also to convene with other health centers across the state and in NAC health centers from all across the nation. And then finally, National Health Center Week. The week has just been announced. It's August 13th through 19th. This is going to be incredibly important this year because this is during the August recess when federal lawmakers are back in the state getting reacquainted with what things are like in their district, and what a great opportunity to bring them into health centers, to invite them to health fairs, to have tours. All of those pieces are really great time, and it's never too early to start planning how you want to make the most of that week. And then that's also a key week for state lawmakers. The legislative session hopefully will be over, and hopefully we won't be in a special session at that point. That's our hope right now. And but it's a great time. They've had, a lot of times lawmakers kind of take some time in July to recuperate, but by the middle of August, a lot of folks are ready to re-engage and come to a great event at a local health center. So a little bit more on each of these coming up next. So the first one is really about telling that CHC story backed by data, so that component of it. So there are a number of good tools on this, but this is some of the information that we've found to be really helpful at preparing for the fly-in that Vanetta and Brenda took part in, is really just to tell the very basic story of the number of patients, the number of employees, the number of sites, and how that's grown since 2010. So the Affordable Care Act passed, health centers started expanding, a lot has happened. It's been incredible how much the growth has happened. So the number of patients, number of employees, and number of sites statewide, we serve over 400,000 patients, over 4,500 full-time employees, and about 200 sites. It's really quite incredible. The percent of your patients on Medicaid, knowing that number, the key demographics of your patients, rural, urban, race and ethnicity, ages, key special populations, just knowing, really being able to share the key pieces of your population. A little bit on the CCO metrics you're doing well on or have shown the greatest improvement in. I think it's just really around that sort of that quality or outcomes, that where you have where are the greatest success stories, where are the results from innovation that you've made, those pieces. And then finally, the financial importance of Medicaid and the 330 grants on your health center. So as an important part of the community, as an important employer, lawmakers care about your survival, and you're a small business, and knowing that your budget relies on Medicaid and Section 330 grants from HRSA is an important piece to really demonstrate that those are the two pillars. Two really helpful tools that have been recently updated on that final one on the financial impact. Two useful tools from NAC, and I've included the website here. We'll send all this out afterward too. The Medicaid impact statement. This is a piece where you can plug in some of your information and get estimates on the impact if Medicaid expansion were repealed, or if different pieces happen to Medicaid. And there's also a funding cliff impact estimator. I think most everyone used this last time we were facing the funding cliff, but it basically looks at what your grant is and estimates taking 60 to 70% of that away, and what would you be left with. And those are helpful pieces to then pair with an actual story of what would that mean. What would that mean for keeping sites open, having staff, serving patients. So those are two helpful tools there. And then finally on stories, the second sort of piece of this, those are great stories to go with that data that really put a face behind those numbers. A couple of great stories. So I recently emailed everybody asking for stories coming out of the fly-in and coming out of other conversations with staff in all of Oregon, for the full delegation, looking for great stories that they can share on the floor as they speak on bills, share examples while they're talking to colleagues to try to pull some more folks over to the Save Medicaid side of the aisle, and also for individual meetings, for use in the media. There's a whole bunch of uses for stories that folks have probably seen. I just want to we asked for a lot of stories, and we've been sharing those with, just thank you to everyone who grabbed stories. I know it's sort of on top of everything else, but it's been wonderful to see them flowing in. We've been sharing them with Ann Dwyer in Wyden's office, and she's just been thrilled to get them. I can't remember how many we've shared so far, but it's been really good, and thank you to everyone. So a couple of great examples of stories, of types of stories that are really good. So a patient who got covered on the Oregon Health Plan under Medicaid expansion and what it's meant for them. And this can be everything. I think Rachel Post's story, we can probably send this out too. Rachel at Central City Concern, just a beautiful story about a patient that was able to just really turn their life around because of their work in healthcare of losing coverage now. A really dramatic story. There's also stories that aren't as dramatic, but just are about the quality of life. Of, you've got a family and you're worried about them, and having coverage gives you peace of mind, and you're able to do more. Or being able to get partial dentures has been able to get someone to feel more confident, and now they're actually looking for a job now. And it can be pieces that are big and dramatic. It can be pieces that are small but human. A lot of variety here. A couple other examples: a provider who sees how Medicaid has improved health or quality of life for their patients, what it's meant to them as a provider, how they can tell their story. Everyone has a story. Same thing for community health workers, for outreach and enrollment staff and leads at organizations, how you've seen what it feels like when people get coverage. How your health center has helped a patient by going upstream to address the social determinants of health. There's a lot of emerging stories about that work. Or how you've improved quality in a certain area. Thank you. And then a couple tips. It's great to run the story by patients for any corrections. It is their story after all, and to ask their permission to share it publicly. It's good to get written permission, and there's some good templates and examples for getting all that stuff that we can share and that are on the NAC site as well. But really working with patients as partners, not just as an objectified case study, but as a real human, to tell their story so that telling that story is an empowering experience for them, and they can see how it makes a difference to policy change overall. It can help. One tip, some people find it really helpful to create the story by interviewing the patient or interviewing a provider, so just asking key questions. And then when you're writing the story, try to write it as you would tell it to a family member, someone who's not knee-deep in healthcare and our various acronyms and ways of talking about things. So trying to think, okay, how would I tell this story? I try to think about how I would tell it to my mom. My dad is in healthcare, so I don't think how I would tell it to him, but I think about how I would tell it to her. And those stories can be really helpful. And then I wanted to just highlight a little bit about the ACE Center of Excellence. They can really help build systems and culture to help advocacy grow and people to feel empowered and connected and not intimidated by advocacy or policy. There are 3 levels, and our goal is for everyone to, at least half Oregon CHCs to reach the bronze level this year. That would be great. Who knows, we could blow it out of the water. It might happen next week. So below that are the for each level there's a checklist of things that a health center has to reach that bronze level, and a lot of these are really good just capacity pieces, having someone who's actually in charge of advocacy of the committee of people or a certain person, having a plan, having a time to talk about it, staff or board meetings, board resolution, and then really getting some work done as part of that. So having people signed up as advocates to get those email alerts, hosting at least one National Health Center Week event, having a tour of your health center for a policymaker, and doing some work on social media. And I think a lot of folks probably already have hit all of these pieces already and can go even further. But these are some great pieces to have as an ongoing piece. It's almost like you've got a muscle and you want to exercise it so that when you need to make that sprint, you can do it. And that's, I think, what this year is going to be. It's not quite a marathon. It's not quite a sprint. It's more like a series of sprints that will go on for this year. We want to be well trained. A little bit more on the in-person events. Day at the Oregon Capitol. We've got registration is open now. But if you want to get in there now, and of course coordinate with other people at your health center on that. Same thing with NAC Policy and Issues Forum. It's a longer event, so it goes on for really a full week in DC. I'll note that the Hill visits with lawmakers are just on March 30th. Sometimes people are only able to come in for that one day. We do a prep the night before to really hone our messages and practice. And on both of those, on Day at the Capitol and P&I, Policy and Issues Forum, we do prep calls from here at OPCA to help prepare so that you really make the most. This is a lot of time to devote, and so we want to make sure that that time is really well spent. And you've got the preparation, you've got those stories, you know what to expect and can make the most of that day or those days. And then National Health Center Week coming up. So that's it. That is the conclusion of what we've got here, and we would love to answer any questions that you have. So one question that came in from Rachel Post was, can you share stories with the rest of us? And yes, absolutely. I will, I've been compiling them and just sending them as fast as I can to Wyden's office and others, and but it'd be great to get examples of those stories. I think actually one of the things that Wyden's office did was grab that excellent story that Central City Concern had as an example, and seeing that example was, I think, probably really helpful to be able to then go, okay, we've got a story like that. We can do that too. Just an incredible story just came in from outside in. Someone who can finally get housing has now all of her and housing. So you're going to read these and just have a really big box of Kleenex nearby when if you want to just personal tip. Yeah, they're great stories. They're incredible, and it's really powerful. Other questions from the group?
And if you have questions, go ahead and write them in the chat box, and here and we'll answer them.
Great. Yeah.
Laura, what percentage of health centers are bronze level right now? What baseline are we working from?
In Oregon?
Mm-hmm.
No one. We've got 0 at bronze right now. So I think probably we have some like stealth bronze that just haven't actually done the checklist and notified NAC. But NAC has a nice little page. You get a little notification. There's a running tally. There's a whole thing. So we've got no one from Oregon in there right now that we know of, unless their website's woefully outdated, but they're pretty on top of that thing. So, yeah.
Might be nice to add that to our network scorecard.
Yeah, we could be like most improved. Great. So, as I said, this is a work in progress. This is our best thinking right now. This is all new territory, and some of it is very familiar territory from old fights that many of you have much more experience in than I do. So it will take all of us to refine this, to make tweaks, to think of new pieces as we go forward. There are so many challenges in the year ahead, but we do really have a whole set of strengths that really lend themselves to being successful in this. So I want to just thank everyone for taking the time to be on today. Really looking forward to working together with everyone on this effort. And we'll probably have another one of these webinars, or probably have a little bit more conversation-based and do some troubleshooting, sharing different story techniques, all those different pieces. So I think this is, while we don't have a regular thing set up quite yet, hoping to just be able to grab on the phone together with each other as we go forward. Yeah, on the phone and in person. Right? Do we have any other questions?
Doesn't look like it.
Doesn't look like it? All right.
Thank you.
Great. Thank you, everyone. Really appreciate it. I think we can probably sign off. We will be sending out a recording of today and a copy of the slides and just a one-pager with links to some of the different resources, and also compiling those stories. That might take a little bit of time, so it might be next week. So that's what we've got. Thank you so much, everyone.